So wellbeing and mental health have rightly become a major focus. What has the service done to ensure our people are fully supported in these areas? So our wellbeing and mental health offer has greatly improved over the last few years. Not only do we have the mental health board now, but it's also chaired by the Chief Fire Officer. They've developed a mental health action plan to detail and monitor what those activities look like and to break down the mental health stigma. We have also produced several sort of mental health leaflets and posters. There's been mental health training events, including the iLearn packages. We've trained mental health champions. We've done a trim refresher. So much more. There's so much more than there was before. We've also updated our mental health policy. We've incorporated the revised trim process. We've introduced FDO support. And then we've got welfare support through our new ways of working. And then to support all of that, the service is also working with the University of Hertfordshire to provide a study to explore local practice aimed at normalising mental health experiences. So aside from the changes made to the ADC processes and the development policies, the service have brought in a succession planning toolkit, and that's been developed to ensure that every employee will have a career conversation with their manager, and then what can be done about that within the PMDS process or the new performance and goals that will be coming in later in the year. We also do effective workforce planning now, and the service is much better at predicting and forecasting the establishment and the requirements through the annual reports delivered to board. This in turn then informs the recruitment approach, but it also informs the plans for the ADC events and processes throughout the year. So we have the Diversity and Inclusion Board. This is now attended by representatives from a number of staff groups. We ensure that all employees are represented, that they're listened to, and the appropriate actions are taken. So staff will see that there have been regular diversity and inclusion updates on Protect, and much further information shared with the staff. So our most recent staff survey that we had in 2021, the results actually confirmed that 93% of employees were aware of our commitment to inclusion, and 92% understand their role in creating an inclusive workplace. And this is of course part of the wider HEC diversity and inclusion strategies relating to the workforce and our communities. We've also delivered 32 developing an inclusive workplace sessions to watchers and other colleagues across the service. These sessions do actually encourage, a lot more open conversation around diversity and inclusion, and have been supported by operational SING representatives to help bring those sessions to life with real life experiences. The service has also continued its positive action campaign when recruiting. We did this even throughout the pandemic. Our most recent campaigns have actually increased the diversity in the workplace. And if anyone wanted to know, we do this through adding a statement in the adverts. We encourage underrepresented groups to apply. We also use a gender decoder, and that identifies language that won't put certain groups off, as well as the targeted social media engagement. And then looking nationally, we look at what's taking place from the NFCC Equality of Access to Services, how Hertfordshire can benefit from this. But I think our people are the most important part of our service, and only by ensuring that we are, they are well supported, we can ensure that Hertfordshire remains an integrated and critical part of the county, that it's reflective and that it's ready for the future.